This videotape presentation discusses your right to understand the eye surgery you're considering. Your eye surgeon wants you to know why and how the surgery will be done, what the benefits, risks, and possible complications are, and what reasonable alternatives are available for your condition. This is an ethical and legal request for your informed consent for the Visian ICL, an intraocular lens that is placed in the eye without removing your own lens. It was developed by Star Surgical Company, a world leader in the eye care industry. This program is designed to give you the information you need to make an informed choice of whether or not to undergo vision correction utilizing a lens that is implanted inside the eye. The Visian lens is comprised of a highly biocompatible material called Collamer, which contains a small amount of purified collagen. This material is made to live comfortably inside your eye. Although this procedure is considered safe and effective, as with any medical treatment or procedure, there are possible risks and complications. This program will discuss these potential problems. Because Visian ICL is a relatively new surgery, there may be long-term effects not yet known or anticipated at the present time. The Visian ICL is a new technology that currently allows individuals with nearsightedness, even those with high degrees of myopia, to enjoy clear vision and possibly reduce or eliminate the need for glasses or contact lenses. This new technology borrows a tried and tested concept used for decades in successfully treating cataracts, an implantable lens. However, there is a major difference. In cataract surgery, the eye's cloudy lens is removed before doctors replace it with a new synthetic lens that gives the patient crisp, new vision. With the Visian ICL, the eye's natural lens is left in place, perfectly intact, while a new lens designed specifically to correct your visual problems is placed in front of the natural lens and behind the iris. Approximately 2 weeks before your surgery, your doctor will perform a procedure that involves making 2 small openings in your iris, the colored part of your eye. This is done with the use of a laser and is usually performed in the office. These openings will help to ensure that fluid will not build up behind the new Visian ICL once it's implanted. On the day of surgery, the surgeon will dilate your iris and anesthetize your eye with the use of eye drops. You will be awake during the procedure, but you should not feel any pain or discomfort during the process, which lasts only minutes per eye. First, a microscopic incision is made in the cornea. Next, the Visian ICL is guided and inserted into its proper position using an injection system. This method allows the lens to be folded so it can be delivered through a very small incision that heals quickly, usually without the need for sutures. Following the lens implantation, your pupil will be constricted and flushed with sterile saline solution. Almost immediately, you should notice an improvement in your vision. However, it's necessary to have someone come with you on the day of your procedure to drive you home. As with any medical procedure, it's important that you have reasonable expectations with regards to the results you can achieve. The goal of Visian ICL is to improve vision to the point of no longer being dependent on glasses or contact lenses. For most people undergoing this procedure, this goal is achieved, but it is not guaranteed. Some people may still need to wear glasses or contact lenses for some tasks. However, studies performed in the past few years show that an overwhelming majority of patients achieve vision of 20/40 or better. This is the vision needed to pass a driver's license test and perform most daily activities without the need for glasses. Many people do indeed end up with 20/20 vision or better. Your outcome, however, depends on several factors, including the severity of your vision problem. Therefore, 20/20 vision or even 20/40 vision cannot be guaranteed. It's also important to note that each person heals differently, and the healing process may affect your results. Therefore, good results cannot be guaranteed, even if you are considered an ideal candidate. Finally, it's important to know that if you are over 40, the Visian ICL does not correct the condition known as presbyopia, or aging of the eye. Even after getting good results with the Visian ICL, you may still need reading glasses. Like all surgical procedures, there is the potential for risks and complications. Every patient should weigh the chance of experiencing complications against the potential benefits the Visian ICL can afford. Loss of vision is a real and potential risk of any eye surgery. There are also potential problems such as infection, cataract formation, or loss of cells from the cornea, known as endothelial cell loss, that can cause loss of best corrected vision. This means even with glasses, you may not see as well as you did before the surgery. Complications such as these can usually be successfully controlled by antibiotics, steroids, additional surgery, or other necessary treatments. Any surgery to the eye may increase the likelihood of premature cataract formation, including Visian ICL. If a cataract develops prematurely, it can be removed and replaced with an intraocular lens, a common procedure that has been performed for years. Endothelial cell loss is a complication that occurs when a thin layer of cells that line the underside of the cornea are damaged. This can occur during any intraocular surgery. These cells may not regenerate or heal themselves. A significant loss of endothelial cells may eventually lead to loss of visual acuity. There are other complications to consider as well. These include tissue erosion, movement or dislocation of the lens, secondary glaucoma, and damage to the iris. There are potential problems as well that could result from the iridotomy that is performed with a YAG laser weeks prior to your procedure. These include damage to your natural lens, inflammation, and temporary increases of inner eye pressure. Glare and halos may also occur. There are also complications of surgery in general that may include adverse reactions to any anesthesia or drugs that may be used during this procedure. Since it is impossible to state all potential risks of any surgery or procedure, this program does not provide a comprehensive listing of every conceivable problem. However, it should be noted that Visian ICL is a very precise treatment that has been proven safe and effective. This procedure has been performed successfully around the world since the early 1990s, helping tens of thousands of people achieve better vision. It is important to note that if problems do arise, the Visian ICL can be surgically removed, leaving your eye essentially the way it was before the procedure. This is in direct contrast to other refractive procedures performed today, which require a physical reshaping of the eye in order to achieve improved vision. However, it should be noted that Visian ICL is intended to be a permanent procedure. Once implanted, the ICL will remain in place without requiring any maintenance. A common result of any type of refractive procedure is overcorrection or undercorrection. In these cases, the lens may be replaced using a different prescription lens, or additional surgery may be necessary. In some cases, glasses or contact lenses may be needed in obtaining a patient's best level of visual acuity. Not everyone can have refractive surgery. Eligibility depends on the amount of refractive error, as well as a number of other factors that your ophthalmologist must evaluate. Generally, the Visian ICL is recommended for people over the age of 21 with a refractive error of nearsightedness of between -3 and -20. It's estimated that by the age of 21, your vision has probably stabilized. However, this is not true of everyone. If your vision is still undergoing substantial change and you continually have to update your prescription for glasses, your doctor may advise you to wait until your vision stabilizes. You will be eligible for the surgery if you have a healthy number of cells in your cornea, as well as a sufficient chamber depth in your eye. If you've been diagnosed as having narrow angles, you will not be recommended for this surgery. If your astigmatism is more than 2.5 diopters, you may not be eligible for the procedure. Finally, if you are pregnant or nursing, you may want to postpone surgery due to the temporary fluctuations in vision that may occur. Visian ICL is purely an elective procedure, and you may decide not to have this procedure at all. Other alternatives include continuing to wear eyeglasses or contact lenses. There are also other options as well to consider, including laser-assisted in situ keratomylosis, or LASIK, photorefractive keratectomy, known as PRK, RK, radial keratotomy, as well as other refractive procedures available today. Your ophthalmologist will be your best source in deciding whether the Visian ICL is best for you. Of course, there are immeasurable benefits to be obtained from the Visian ICL procedure. The most obvious one is better vision and the opportunity to no longer be dependent on glasses or contact lenses to do all the things in life you enjoy. This advanced technology has proven in numerous independent studies that indeed most people undergoing Visian ICL do achieve excellent vision without the need for visual aids. In fact, one of the biggest benefits of the ICL is its ability to correct a much wider range of individuals, even those requiring high degrees of correction. Many people who are not considered for other treatments such as LASIK and RK may be a good candidate for the Visian ICL. The technology is additive and rests invisible and undetectable within the eye. However, as we've pointed out in this program, there are no guarantees over the outcome of this or any other type of refractive surgery. That is why you should choose a qualified surgeon who can adequately and completely evaluate your vision problems and answer any questions you may have about the Visian ICL. Your surgeon wants you to make the right decision regarding your eyesight and is willing to take the time to explain any and all details regarding this procedure. A good and informed decision makes for good and lasting results, results that just may change your life forever. We hope this video has given you a better understanding of Visian ICL, how it works, and what risks and complications are associated with this procedure. As part of the education process, we'd like you to take the following quiz to test your knowledge of this procedure. After you're finished, check your answers with a member of the staff. Question 1. Visian ICL will guarantee you will no longer need glasses or contact lenses after surgery. Question 2. The Visian ICL is intended as a permanent procedure. However, the lens can be removed if problems exist. Question 3. Patients undergoing this procedure will be asleep and unaware of their surroundings. Question 4. Anyone who wants better vision is a candidate for Visian ICL. Question 5. Visian ICL is purely an elective procedure. One alternative is to continue to wear your glasses or contact lenses. Question 6. Visian ICL will eliminate the need for reading glasses in older patients. Question 7. Loss of vision is a real and potential risk of any eye surgery. Question 8. One of the benefits of the Visian ICL is that it offers better vision to a wider range of people, even those not considered good candidates for other refractive procedures. Question 9. This video has listed all of the possible risks and complications that may occur.